It's quite surprising. Think about lush green grass. Seems perfect for a cow, right? But sometimes, if it's low in magnesium, it can actually cause something called grass tetany.
That's right. They can become uncoordinated, twitchy.
Yeah.
It's a classic example of how complex nutrition really is, even in seemingly ideal conditions.
Exactly. Welcome, everyone, to the deep dive. Today, we're digging into a topic that's, well, crucial for our food supply, for agriculture, and definitely for animal welfare, cattle malnutrition.
And we've got a great set of sources here. Really detailed stuff covering, everything from the subtle signs to how you actually treat and prevent these issues in cattle.
Our mission, as always, is to cut through all that information and give you the key takeaways. Think of this as your fast track to getting up to speed on a really important agricultural subject. We'll hit some surprising facts, some practical insights.
Yeah, it's not just about animals going hungry. It's much more nuanced than that.
So what does it all mean for our herds? For the bigger picture, let's unpack it.
Well, fundamentally, malnutrition happens when a cow just isn't getting the nutrients it needs.
Yeah.
And it's not just feeling a bit off. It spirals.
Spirals how?
You see poor body condition, obviously, but also their immune system takes a hit, productivity drops, whether that's milk or growth, and they become much more susceptible to diseases. It's like running a complex machine without the right fuel or maintenance.
A cascade effect, then. It affects everything. Profitability for farmers, too, I imagine.
Absolutely. It hits the bottom line hard, and the main drivers are usually deficits in energy, protein, vitamins, or minerals.
So where do those deficits come from? Is it just not enough food?
Sometimes, yes.
Yeah.
Insufficient supply, maybe due to drought, or just too many animals competing for the same troughs. But often it's the quality of the feed, even if there's plenty of it.
Ah, right. So they could have a full belly but still be malnourished.
Exactly. Think mature, dry pastures or low-quality crop residues. They fill the space, but they lack the essential nutrients. Or the diet might just be imbalanced for what that specific animal needs at that time.
That makes sense. So it's about what they eat, not just how much. Our sources mention some common imbalances. What are the big ones we should know about?
Probably the most common is protein energy malnutrition, or PEM. You see this a lot, especially late in pregnancy.
Why then specifically?
Well, the fetus is growing rapidly, demanding lots of energy and protein, but at the same time, the calf is taking up space, so the cow physically might not eat as much. It's a tough balance.
Okay, PEM. What else? Minerals seem to come up a lot.
Oh, definitely. Both the major ones, like calcium, phosphorus, magnesium, and the trace minerals, copper, zinc, selenium, cobalt. These are critical.
And deficiencies can come from the soil itself.
Yes, soil deficiencies are a big factor in some areas.
Hmm.
Or it could be the diet mix, maybe too much grain throwing off the calcium-phosphorus ratio. Or sometimes minerals actually interfere with each other's absorption. It gets complicated.
And vitamins. We think about vitamin A for eyesight, D for bones. Same importance for cattle.
Absolutely crucial. Vitamins A, D, and E are vital for all sorts of things: vision, bone health, immunity, reproduction. Without fresh green forage or proper supplements, deficiencies can definitely crop up.
Okay, so feed qualities, specific balances like PM, minerals, vitamins. What about things that might get overlooked? You mentioned some surprising factors earlier.
Right, like water. It sounds obvious, but it's arguably the most essential nutrient. If cattle don't have enough clean, fresh water, their feed intake plummets. Simple as that. Poor water quality can put them off drinking too.
I wouldn't have guessed water would be the top factor. What else?
Sudden changes in diet. If you switch them too quickly, say from pasture to a high-grain feedlot diet, you can wreck the balance of microbes in their rumen.
The rumen. That's their big fermentation vat, right?
Exactly. Disrupt those microbes, and you get digestive problems like bloat or acidosis, and they just can't absorb nutrients properly, even if the feed itself is good.
Wow. So gradual changes are key. Does the environment play a part, like weather?
A huge part. Extreme cold or heat dramatically increases their energy needs just to maintain body temperature. If they're not getting extra energy from feed, they start burning through their body fat reserves fast.
And that leads to weight loss, obviously.
Significant weight loss. And then, of course, you have underlying health problems, diseases, internal parasites stealing nutrients, injuries making it hard to graze, even bad teeth impacting chewing. All these can contribute to or worsen malnutrition.
It's a whole web of factors. You mentioned some specific conditions earlier, like grass tetany. Any others that stand out?
Yeah, there are a few interesting ones. Urinary calculi, basically stones, can be a problem, especially in steers on high-grain diets with the wrong calcium to phosphorus balance.
Ouch.
And ketosis is a big one in dairy cows, particularly right after calving. Their milk production ramps up hugely, demanding lots of energy. If they can't eat enough to meet that demand, they mobilize too much body fat, leading to metabolic problems.
It really shows how finely tuned their systems are. So if things start to go wrong, what are the signs? How can you tell a cow is malnourished?
Well, the most obvious things are visual. Weight loss is key. You start seeing bones, the ribs, the spine, the hip bones become really prominent. That's a low body condition score.
What else?
Their coat often looks dull, rough, maybe even patchy hair loss. They might seem weak, lethargic, just low energy. Sunken eyes can be a sign, and a tucked-up belly appearance often goes with severe weight loss and dehydration.
So visible changes in body and energy. What about performance?
Big impacts there. Decreased milk production is a major sign in dairy cows. In young animals, you'll see poor or slowed growth. Reproduction suffers too difficulty getting pregnant, lower conception rates.
And you mentioned immunity.
Right. Malnutrition weakens their immune system significantly, so they're much more likely to get sick from various infections. This is especially critical for calves born to malnourished mothers. They often start life with a weaker immune system.
Okay, so general signs are important, but you also mentioned that specific deficiencies can cause specific symptoms. That sounds really useful for diagnosis.
It is. These can be real clues. For example, really severe protein deficiency. You'll see noticeable muscle wasting.
Okay.
Lack of energy leads to that emaciation, but also trouble regulating body temperature. Vitamin A deficiency. Classic sign is night blindness. You might literally see them bumping into things in low light.
Wow.
Vitamin D problems can cause rickets, bone issues in calves, or osteomalacia, a similar softening of bones in adults. Lack of vitamin E or selenium, that can lead to white muscle disease in calves, affecting their muscles. Or, surprisingly, issues like retained placentas after calving.
Retained placenta from a vitamin deficiency.
Yes, it's linked. Then there's calcium. Low calcium around calving causes milk fever. The cow often goes down and can't get up. Phosphorus deficiency can lead to precavias. They start eating weird things like dirt, wood, bones.
Trying to get minerals any way they can.
Seems like it. Copper deficiency is interesting. It can cause anemia, but also loss of hair pigment, so black cattle might start looking reddish or grayish. And diarrhea can be a sign too.
Changes hair color. That's specific.
It is. Zinc deficiency affects the skin. And hooves, poor wound healing, rough skin, lesions, swollen or cracked hooves. And magnesium, as we started with, leads to grass tetany, that incoordination, muscle twitching, staggering.
Those are incredibly distinct signs. It really highlights the need to look closely. So if you suspect malnutrition based on these signs, how do you confirm it? How does diagnosis work?
It usually starts with a good clinical exam.
Mm-hmm.
Looking at the animal, assessing that body condition score, checking the coat, observing their behavior, and crucially, getting a thorough history. What exactly have they been eating? What are the management practices?
But just looking and asking isn't always enough, right? You need hard data.
Absolutely. You often need laboratory tests. Blood samples can measure levels of specific nutrients, protein, calcium, phosphorus, trace minerals like copper or selenium. That gives you a direct look.
Okay.
And just as importantly, you need feed analysis. Testing the actual hay, silage, grain, or pasture they're consuming tells you what nutrients are supposed to be available in their diet. Comparing that to their needs is critical.
So you compare what they should be getting from the feed test to what their blood levels show alongside the clinical signs.
Exactly. In severe cases that result in death, a necropsy or postmortem examination can also show things like muscle wasting and depleted fat reserves, confirming severe malnutrition.
All right, so you've got a diagnosis. What's the path to recovery? How do you treat it?
The number one thing is correcting the diet. That sounds simple, but it means providing feed that's adequate and balanced in energy, protein, vitamins, and minerals for that specific animal's needs.
Needs vary a lot.
Hugely.
Right.
A pregnant cow, a lactating cow, a growing steer, a calf, they all have different requirements. So the diet needs to be tailored. High-quality forages are usually the starting point.
And supplements.
Often necessary. Things like protein blocks, carefully formulated mineral mixes, paying attention to that calcium-phosphorus ratio, often needing something like 1.5.1 or up to 3.1, can help fill gaps. Sometimes injectable vitamins like A, D, and E are used for a faster response if deficiencies are severe.
Makes sense. Is it just about changing the feed, or does management come into play too?
Management is huge. Things like improving pasture quality through fertilization or rotation, making sure stocking density isn't too high so there's less competition for feed, and back to water, ensuring constant access to clean, fresh water is non-negotiable.
And those underlying issues you mentioned.
Got to address those too. Deworming programs to control parasites, treating any concurrent diseases, checking teeth, especially in older animals. Providing shelter can also make a difference, reducing energy loss from heat or cold stress, especially for thinner animals.
Are there animals that need special attention, like young ones?
Definitely. First calf heifers are a key group. They're still growing themselves while producing milk and recovering from pregnancy, so their energy and protein needs are about 10–15% higher than mature cows.
So they need extra care.
They do. Newborn calves obviously need enough good quality colostrum right away for immunity and then adequate milk. Creep feeding, providing supplemental feed just for calves, can also help give them a boost. And bulls need attention too, especially after the breeding season, to get back into good condition.
It seems like prevention would be much better than trying to fix the problem afterwards.
Oh, absolutely. Prevention is key.
Yeah.
That involves regular monitoring, keeping an eye on body condition scores throughout the year, tracking growth rates in young stock.
Being proactive, not reactive.
Exactly. Planning diets carefully, making sure they're balanced for the stage of production before problems start. Using supplements strategically during periods of high demand, like late pregnancy or early lactation. And just good overall management pasture rotation, providing free choice mineral blocks, especially if you know your area has soil deficiencies.
And if you do catch it early.
If it's caught early and corrected properly, the prognosis is usually good. Cattle can recover well. But if malnutrition is severe and prolonged, it can lead to permanent stunting, poor productivity long term, or, unfortunately, may not be reversible.
Right. So let's bring this all together. What does this deep dive really tell us? We've seen that cattle malnutrition isn't just about an empty stomach. It's this intricate web of specific nutrients, feed quality, environmental stress, even things like water access and sudden diet changes.
Yeah, and recognizing the signs, whether it's a dull coat, muscle wasting, or something as specific as night blindness or pica, is so important for stepping in quickly.
It really underscores how complex these biological systems are, doesn't it? Small imbalances can ripple outwards with pretty big consequences. And that matters whether you're directly involved in farming, interested in animal welfare, or just curious about where our food comes from and the systems that support it.
Absolutely. It's a reminder of the fundamentals that underpin a healthy, productive herd.
So here's a final thought for you to ponder. We've seen how the health of an animal, as seemingly robust as cattle, is tied so tightly to specific nutrient balances, subtle environmental shifts, and management details. If their well-being depends on such a delicate balance, what does that suggest about the balance required for the health and resilience of any complex system, maybe even our own?